We will transition now to our community engaged research panel, which is chaired by my friend and colleague, Dr. Marlene Saunders. Dr. Saunders is a social worker. She is a social work educator. She is an elected official, and her main title is, of course, Force of Nature. She is co-chair of the conference today. She's also chairperson of the ACCEL Community Advisory Council. She will be chairing the next session, after which there will be a virtual poster session, which you can enjoy during the lunch break, after which we will reconvene as well for our workshops. So Dr. Saunders, thank you so much. And I'll turn it over to you now. Thanks so much.
Well, thank you so much, Omar, Dr. Khan. It is a great pleasure to be on the program at this point to have a discussion about community engaged research, benefits, challenges, and realities. We are very fortunate to have a very accomplished panel to discuss community engaged research, across the translational spectrum. And what I am going to do is to introduce our panelists. And I might add that these four women have extensive backgrounds. I am going to just give partial biographies about their background and their experience. I would invite the audience to read their full backgrounds, which are located in the program, beginning on page 13. I will begin with Dr. Dorothy Dillard, who earned her doctorate at the University of Delaware in 1994. She is a sociologist and consultant with academic experience in substance abuse treatment, racial disparities in the juvenile criminal justice systems, and offender programming. Dr. Dillard has over 30 years researching, evaluating, and teaching, and served as the chair of the Department of Sociology and Criminal Justice at Delaware State University from 2014 to 2019. As the director of Delaware State University Center for Neighborhood Revitalization and Research, she is responsible for developing and overseeing practice research partnerships across a range of areas. The CNNR engages students, faculty, service providers, and neighborhood residents in research and decision-making process through practice partnerships. Dr. Dillard currently serves as the lead research partner with the Reach Riverside Initiative and the Dover Project Safe Neighborhood Revitalization efforts. As I indicated before, Dr. Dillard's experience and expertise is deep. I'm not going to continue with her bio. Please go to page 13 in the program. Next, we have Dr. Vicky L. Fulinaj, is a molecular geneticist who joined Nemours Children's Health in July 1981. She holds faculty positions at the Sidney Kimmel Medical College, Thomas Jefferson University, and the University of Delaware. She was appointed to the position of Operational Vice President, Executive Director of Research in 2014, having served as Director of Biomedical Research for Nemours Children since June 2000, and Director of Medical Research in the Delaware Valley since December 1998. She is also the Director of the CLIA Certified Molecular Diagnostic Laboratory, head of the Musculoskeletal Inherited Disease Laboratory, and one of the strategic leads for the Precision Medicine Program at Nemours. Again, please go to page 13 for the rest of her biography. Next, I'm pleased to introduce Dr. Sims Mortada, is a lead research scientist and the director of translational breast cancer research in the Center for Translational Cancer Research. Dr. Sims Mortada earned her doctorate in immunology in 2004 from University of Texas Graduate School of Biomedical Sciences in Houston, and completed her postdoctoral training in the Department of Experimental Radiation Oncology at the University of Texas. Last but not least, we have Dr. Erica Sood, is a pediatric psychologist, at Memorial Children's Health, and associate professor of pediatrics at Thomas Jefferson University. Dr. Sood's research focuses on partnering with patient and family stakeholders to identify unmet needs, generate recommendations for psychosocial care, and design interventions to improve psychosocial and neurodevelopment outcomes. Pardon me 1 second. Good morning. This morning, we have heard a number of presentations that talk about community engagement across the translational spectrum. And having heard those discussions, we've also heard that while community engagement is a core element in research, it's not always easy to achieve. Having heard those discussions and having heard this introduction to my first question, does anyone want to begin about talking about the challenges that you see with respect to community engagement across the translational spectrum?
I can start with just one point, which is that I think many of us don't have formal training in community engagement in research. And so when I think back to graduate school, I got training in many different areas of research. Community engagement was not one of them, and I wish it was. And so I had to learn on the job. I learned a lot through my different experiences in ACCEL. But I think that that is one of the challenges, and that goes for researchers, that goes for research coordinators, research staff, and I think that also goes for the partners themselves in terms of having kind of formal structures for mentorship, for training, and then for ongoing coaching or formative feedback. I've been doing community engaged research for many years now, and maybe this is just how I've set up my projects, but I'm not sure that I've ever received formal feedback on how I'm doing as a PI working with community partners. And I think that would be helpful. So I think that's one of, there's many challenges, but I think that's one of them, is that many of us, when we were learning how to do research, this wasn't one of the things that we learned.
Jennifer, you're shaking your head?
Yeah, I mean, I agree. I also have no formal training in any kind of community engaged research. And the research that I do is really on that tier 0 to tier 1, really early in research. And so putting together my group, we have a community research advisory board for our breast cancer group. I found it was a little bit difficult as they kind of understood research from clinical trials moving on. Really, when we're starting back at the basic science research, it was a little bit difficult in the beginning for me to kind of find my ground as to, what do I need from them? I knew I wanted them to be involved, but how do we approach this? What type of projects could we do? And they were always pulling in an outreach and education dissemination. And it took some time for me to really understand that that's very important to what I do. And dissemination of our findings really drive all of the other things, and making sure that those are accurate. And so it's been a learning experience for me just about how to approach what we do, because I wasn't able to find any real guidelines or a roadmap for this is how you go about this, particularly early on in our translational research program.
Dorothy, you're shaking your head as well.
I am, and I think that that's really important, is looking at the full spectrum. And I know during one of the keynote talks that was emphasized in understanding where you fit in on that spectrum. And so that helps define in some ways who your community is, the people coming next and the people who came before you on that spectrum. As far as my experience goes, I come to this focus and type of research from a different perspective. I am a sociologist, and so my research training was very much about the lived experience. And so I'm very grateful for those techniques and knowing how to use those and translate those for this type of research. But I also want to emphasize that when we look at that spectrum from T0 to T4 and trying to figure out where we are, it looks linear and it looks at first glance, and it looks kind of like these boxes are separated from each other. And I think that we need to continue to work. And I was excited to see this panel, didn't understand half of the words I saw associated with the names in the research. But to know that we're talking across the translational spectrum together to figure out the community engaged research piece, because it needs to be fluid. And when we think about the entrenched health disparities that we have, we're not always working from 0 to 4. For instance, I come into the translational spectrum at 4 with the community engagement piece and trying to understand what's going on out there in the community at that far end. And so one of my challenges is how to communicate that backwards across the spectrum so that it can impact what's happening in the laboratory and changing some of those methodologies, but also producing interventions and mechanisms and measures that promote equity and are tailored for different cultures and environments that we have.
One question comes to mind, and it concerns the value, under base, of community engaged research, which was emphasized, this morning. Nothing about us without us. And on one level, that seems very natural and, and sensible, to me. And I tried to think of examples, where that should happen, has happened. And I'm thinking of, the research to find, vaccines for COVID. And one of the realities that came to rise was the underrepresentation of African Americans and people of color, in the trials. And I don't want to get deep in this discussion, but maybe I do. Is what do you think accounts for this transition, this evolution in the thinking of scientists from scientists only being involved, in the research to this whole notion of including, people, as a part, of the research process, and what is your assessment of how difficult it has been for scientists to change, in that respect?
I'll start with that. I think the vaccine hesitancy and the clinical research study we did as part of the ACCEL program is a prime example of assumptions being made. There were assumptions being made that the Black population, for example, was not taking advantage of vaccines because they weren't accessible. It was not easy for them to be vaccinated, but that really wasn't the case at all. There was the distrust and the lack of information, and that was resonating. And so to me, that was eye-opening for a lot of people, and it just speaks to the importance of really understanding the underlying factors that just kind of propel health inequities and access to care. So that was a learning, but I give it to the ACCEL community and the community engagement outreach program, because that was a pilot that they supported.
I think, go ahead.
No, go ahead, Dorothy.
I just think that coupled with that is one, ensuring that our clinical trials are equitable and what our samples look like. We continue to do research, and I'm not throwing shade at anybody, but it's a fact and we need to look at it. But we continue to do research that doesn't include a representative sample, and we will continue to have medical science and knowledge and techniques and interventions that aren't applicable to all folks. So that's one piece that I think is really critical. And I think that we also need to push ourselves to understand cultural differences and historical treatment of different populations. And as a ethical, community engaged researcher, I've had to teach myself all of that. I wasn't taught that. I had the good fortune of teaching methods at an HBCU, and I could walk into that classroom as the authority, as somebody, you know, educated in a PWI, and just use what's in the canon, what's accepted as good science, and not address the ethical issues with what we know about science that involve mistreatment. And that's where that lack of trust still lingers large. And so, you know, I do think that we as researchers need to have to push ourselves to understand that. I mean, I'm working with a new population in Sussex County, Haitian Creole, and you know, we were able to build trust and interest among African American communities across the state with our COVID study in 9 underserved communities in Delaware around COVID and testing and vaccination hesitancy and resistance. And a lot of that had to do with that our research team, made up of students and faculty from DSU, looked a lot like the community. That's important. It wasn't me, I wasn't leading it. You know, they are in the site right on the ground, but we didn't have as much luck with the Haitian Creole. And I've gone back and spent a lot of time listening and learning, and it's a long process. It takes a long time to learn and to build that trust and to find who's willing to have that conversation with me and then bring others into it. So those are just some of the challenges I think that are out there. But we, as advanced as we are in so many ways, we just have forgotten some really critically important and haven't made the transformations in those areas of equity and ethics around equity in our research.
You mentioned time, and I think that's important to consider as well, because it does take time to build teams. It takes time to build those relationships and that trust, and for communities to know that you're not just swooping in to do your research to get your data, then to leave. And I think many of the, you know, many funding sources don't, that time is not built in. And so you might get, you know, a 1-year pilot grant or a 2-year grant, and you're supposed to hit the ground running on you know, month 1. And if you don't already have those communities and those relationships established, it's going to be really hard to do that in that timeline.
Yeah, one thing I like that the keynote speaker said is they provided some sort of resource, some sort of give back, which was more on a short-term basis, because it does take long to do the research. And I thought that was very innovative. And, you know, I would like to learn more about that, and for us to think about ways in which we could incorporate those into our research studies. Again, you know, gaining the trust.
Well, Dorothy gave an example of a community and a population with whom she worked, in Sussex County, namely, the Haitian, Creole community. Vicki, Jennifer, and Erica, can you give us examples of research you have undertaken that represents community engagement?
So on my side, our research is targeted to the African American and African communities in Delaware. We do have a large health disparity in breast cancer, something that's seen across the US. And that was really why we started to form the CRAB. There was an article out in Science, I believe, a few years ago that showed that only 2% of all of our patients from all of our genome-wide association studies that have been done, only 2% of them come from minorities. And so that, for me as a translational researcher, working on biomarkers and treatments for breast cancer, realized I don't even have the samples for the people that I'm trying to help. And so that was one of the reasons to form our group. And in talking to members of the community, I kind of see that what I thought are my perceptions of why we don't have samples were very different from the community. And I think it's important to have those conversations and for every research center to begin to build those relationships and find out what people need. And it might be different for different people in different areas. One of the things that we've done together with our population health group and Dr. Scott Siegel is to do some spatial profiling to really find out where our breast cancer patients live. And to really kind of try to more focus and target our efforts to those areas and get those populations involved in our research. And then to kind of just ask the community, what do you need to participate in our research? And one of the things that we heard at our last community board meeting was they want something back. Translational research takes 10 to 20 years to provide something, but they want to know something immediate. And then, so that kind of validates what we heard earlier in the session, that this is really something that we can do to help the public feel more happy about donating to our studies and feeling that they're really getting something out of it, although they're not, personally going to benefit from the treatment.
Vicki, do you want to answer that question?
Sure. I am more that T0, T1 type researcher, but I can give you an example because I direct a molecular diagnostic lab and provide genetic testing as well as what's called pharmacogenomic testing, understanding the variants that govern our metabolism of drugs and therefore the therapeutic effectiveness that varies within populations. But something totally unanticipated came out with regards to COVID. We had developed a pediatric, it's really pediatric and it can apply to adults, kidney disease testing panel, which wasn't available. And it turns out that one of the variants that's prevalent in the African American population is a variant in apolipoprotein L1 that predisposes to kidney disease. And of course, COVID causes one of its comorbidities is severe kidney disease and kidney failure. So we were able to take some of that and publish that work in the Delaware Journal of Public Health, thanks to the outreach of Omar Khan. And so that is just an example. Now we haven't begun any studies, but it was unanticipated, but it immediately had our attention that we needed to get this information disseminated. So.
I can go next. My research focuses on the psychosocial needs of families of children with congenital heart disease. And right now my research is focusing specifically on the prenatal period. So kind of that period after a prenatal diagnosis of a complex congenital heart defect, which usually happens around 20 weeks gestation, and how to best support and emotionally prepare families for a very stressful experience that they're going to kind of embark on, and this lifelong journey, which will include heart surgery in the first year of life and hospitalization in the intensive care unit and higher rates of developmental delays, after hospitalization and heart surgery. And higher rates of parental anxiety and depression and post-traumatic stress related to some of their early experiences. So the partners in my research have been parents of children with congenital heart disease, and CHD affects, all populations. It's not, it's not grouped in one demographic. And so we really try to ensure that, that our samples are representative of the population. That has been a challenge in the past. I think that the literature in this area is not as representative as it should be, but we've used, different sampling strategies and partnerships to increase our diversity in our samples, and including Spanish-speaking families. And those have been certainly helpful. I think one of the challenges that I've kind of been trying to tackle is really, having partners, parents as partners on research studies, in a pediatric setting. Very often, even if you do engage in community engaged research, you often are working with white moms. It tends to be, unfortunately, I think that many partners in the studies that are community engaged are not very representative of the sample and the population. And so that's one thing that I've really been working on, is how do we, how are we going to partner with, not just as participants, but as research partners with diverse parents from different backgrounds who can really advise the study from start to finish. And so that's, one of the things that I've been working on.
A question that comes to mind, and this has to do with COVID and the pandemic, particularly when we got close to finding, not close to finding the vaccines, but when participants were necessary for the studies. And the Tuskegee experiment, reared its head, and people talked about suspicions and reluctance, to participate, in the research because of the Tuskegee, experiment. My question is how, as scientists, researchers who are about engaging community, do you go about offsetting perceptions that might help to explain why people don't want to get involved in research, not only on the part of Americans of African descent, but other groups as well. So I guess what I'm trying to get at are the common elements of that, as well as the uniquenesses of that, and how the common elements versus the unique elements help you organize how you will engage ordinary people, in research. I hope that question's clear.
I know for the COVID study that we're conducting, it was really important, and it's about time. I mean, all relationships are about time and patience, and but I think that the biggest thing that we learned is, and we knew this going in, but I think we're always surprised by how it looks a little bit different. But we have to go to them, and we have to go to them in a way that is acceptable and that they're open to responding to. So what that means is finding not only the community partners to help us understand the landscape that we're working in, because Sussex County is very different than Kent, is very different than Newcastle, and then also finding those trusted facilities where folks who we wanted to be in our study to learn more from are willing to go. And sometimes it means being at that trusted facility until somebody is curious enough about why you're there. And I'll give a quick example. In one of our studies, we were at a small community center. It's not even a center, it's sort of a community building. All sorts of information through several different community groups and folks doing outreach and connecting people to services in that community, that we would be there. We show up during the scheduled time, nobody shows up. do it again the next week, nobody shows up, do it a third week, nobody shows up. Fourth week there, one of the community leaders, not an official role, just somebody who the community knows, she walks in the door and she goes, "What are you all doing here?" And she thought it was testing. And when we told her what it was, she agreed to participate in the study. Next week, 14 people showed up. So, you know, we have to be where the folks are. We have to learn. We've had to learn. We started out with 2 fantastic community partners who connected us to the trusted facilities, and we've developed some of those on our own. So I always think of community engaged research as a continuous process of digging deeper and wider. So every time, you know, we bring on new partners, it's also important to be respectful of those community partners and the trusted facilities, and to be able to provide for them things that they need that make it important, whether that be, excuse me, you know, supporting one of their staff people to help us, or providing during COVID, the protective, you know, masks and other things. And so it's about respect, relationship building, and patience in a lot of ways.
Yeah, I think we need to be better as working as teams, or the super teams that I heard the phrase today, across the translational research spectrum, and then have that portal for engaging the community. I think I saw a flywheel, but engaging them at that front end. And that's an opportunity for us, because we've all talked about, oh, that's my area of expertise and this is my area, but we don't really, we work well together, but we don't think ahead of time about how we could put together teams, nimble teams, to work together on projects. And I think that's an opportunity.
Well, one thought that has come to my mind, and I'm going to use you know, some of the words, some of the descriptions that you have used in terms of relationships, you know, going where they are. And what I find is that we're in and out. You know, we go to where people are, but then we're out. And so I've had this notion of having like a community outlet, you know, in the community, you know, where we're in the community more than just for, you know, a community meeting or to do this or to do that. I don't know how that idea sets with you all, in as much as you are advocates of community engaged research. You know, relationships are ongoing. It takes time, you know, to develop, and the extent to which being in the community would help to, you know, address some of the limitations, some of the challenges, you know, associated with a community engaged research.
I think, you know, in my research, the community again is families of children with a specific condition, and there are many groups and you know, organizations nationally, locally, that are dedicated to that. And so I think one of the ways that I've done this is really to just be part of that community. And you know, I'm on advisory boards, scientific advisory boards, medical advisory boards for all these different organizations, and you know, I'm writing summaries and doing community presentations and serving as partners in their projects as well. And so I think that has been helpful. You know, I certainly don't have that feeling of I'm swooping in and then I'm leaving. I had that in the past. I mean, I think my dissertation, when I think back, was very much that way. And I didn't realize that at the time. But I think now as a faculty member, I have these established relationships. And so I think that's really important. And so when I'm asking something from a community, I think they have a level of trust in me that I think they wouldn't otherwise have.
I think my group, we lean very heavily on our outreach team. We have a very well-developed cancer outreach team. And so to kind of, you know, tag team with them, and that's why I said initially, you know, the community group really wanted this outreach and dissemination. And now I understand how important it is to tell them what happened with the specimens that I got from them or the surveys that we got from them, and have that continuous pipeline coming out of, you know, we did this study and this happened, and a way to be able to directly speak to the community, to kind of make sure that they understand our commitment is long-term. You know, a study may end, but as a program, we have a long-term commitment to the community, and having a presence in the community is very important.
Today's conference has been very, you know, instructional and informative to me in terms of actually defining, describing, you know, a translational research, you know, across, you know, the spectrum from TO, you know, to T4. Can you all give, you know, one of the questions that, you know, we framed for you was to give examples of T1, T2, T3, and T4, research. Does anybody want to start with trying to answer that question? Or
we have a very early project. You know, again, it's through the discovery, through the pharmacogenomics efforts that we're doing, and we're conducting a study now in the sickle cell disease population, both in Delaware and Florida, and looking at pain management and how effective the medications that are given to patients based on the variations that I was talking about manage their pain, and it's changing their course of care. So what I mean by that is we're finding out preemptively that this drug may not work. We're going to prescribe another one, or we're going to change the dose or whatever. And it's having, this is just very early on, but just really compelling impact on their care and on their outcome, which outcomes they're with regards to pain, which is just one of the worst aspects of sickle cell anemia. So that can get there, and it's conducted by a clinical fellow in conjunction with a hematologist, oncologist, in partnership with the diagnostic lab. So to me, that's something that could be translated then into the community. Not quite there yet. So I don't have the whole complete T1 through T4 example to give, but that one is very exciting based on the early findings. So I don't know if Erica, was your peds net, any of your peds work with K-12?
Yeah. So as part of one of my recent grants, I partnered with stakeholders, both clinicians and parents from 8 different children's hospitals that are part of PEDSNet to design a psychosocial intervention for congenital heart disease called Heart Prep. And that was, I think that would fall in the sort of probably T1, T2, but we partnered with, and we used technology. We used a program called Yammer that folks could access on their phone to be able to participate, so they didn't have to travel. They could do it at any time. There was no really restrictions around that. And our stakeholders, our parents primarily, were involved in determining, you know, what do we want this intervention to focus on? What are the goals of the intervention? And then once they identified the goals, then, okay, now that we have the goals, what are the components that we need to actually deliver to reach those goals? And then now that we have the intervention components, how do we actually deliver it? You know, what's the mode of delivery? When do we introduce it to families? Who should introduce it to families? And then we designed the intervention based on what we had learned from them. And then we also had parents on the study team as well that helped us to write the questions. And then we actually showed them the design, you know, got their feedback. And now we're piloting it at Nemours, and then getting feedback from our participants on acceptability, feasibility. And then the next step is to kind of do a larger kind of rollout of some of the features, and then getting feedback from those that had previously participated in the kind of the early version to get their input. So I think, you know, kind of showing that and all of this built on work that was qualitative interview studies to understand the lived experience of families. And so I think this really built on, what are their experiences and needs, and then what if we're going to do an intervention, is what we're hearing from families that we need, what should that focus on, and then what should it entail, and how should it be delivered, and then kind of getting feedback along the way. So I mean, that's been really exciting to me, to have parents involved, even at the level of just what an intervention should focus on to begin with.
Another question is, in terms of community engaged research, is that community is involved in every phase, of the research process, from thinking of the idea to developing the questions to, developing, the conceptual framework, the methodology, collecting the data, disseminating the data. Can you give examples of how your community engaged research demonstrates community involvement at each stage of the research process? And if you could talk about if there's some stages in the process where involvement of community has been a challenge.
I can talk to that. And I think, and I've heard others say this today, the point of the greatest challenge is at the beginning. And the mad dash that's required to even, if any of us tried to do it alone, which is impossible, but even if it was just one person that we had to deal with, getting through the process of submitting a grant, especially larger grants and federal grants. And it's difficult to bring in folks, and you're trying to manage your institutional process and all of that. So that still seems to be the biggest challenge. And I think that that's a place that the federal government and other funders need to make some adjustments to allow time for that if we want to advance our understanding and addressing health inequities. But with our COVID study, we were able to bring in 2 community groups who were working in the community, helping to respond to COVID, to comment on the proposal and the study protocol, and to share ideas with us. We're very fortunate because I've been allowed the time to do that developmental work, and that's not always true for faculty members who have teaching loads. So I do want to point out that we have a little bit of a luxury with my the way my position is defined, that I can kind of stop everything and spend time with our community partners. So at the point of the proposal, we did get feedback on the study protocol and the implementation. We've continued to work with our community partners in regards to implementation and shifts in implementation. We have a longitudinal study, so it's got 3 waves of interviewing, and our second wave happened right in the middle of the COVID resurgence in the winter, and then really lousy weather. But we worked with our community partners to figure out how to increase that re-engagement. We have had the community folks involved, we've had DSU students involved with the data collection, and DSU students, including Spanish speaking students at each of our sites. Every time, we have a research site, the DSU students are there. So they are reflective of the community. Some of them are from very similar communities. We would certainly like to build on that, and folks that have become involved in our study to continue to, whether they're DSU students or not. So that's a piece that we're building on. But as far as the survey instrument, and here it's often hard when you're doing a study funded by the federal government. They want you to use data collection protocol and instruments that have been validated or approved. but we worked with our community partners and used community folks for our translation with both Haitian Creole version of our survey and Spanish. And we ended up kind of having the Spanish version also vetted in North Delaware and South Delaware, because apparently Spanish is slightly different and in different communities. So we did that, and we're just now really starting to get the data back, and I've continuously brought findings as they become available back to the community level folks. So not the study participant level, but the community advocates and community-based organizations to share those findings. But we also want to open up at community centers for assistance with interpretation from the residents in the communities where we've been working. And then we've also been trying to increase inclusion of the survey participants or folks like them who live in the community, underserved, marginalized communities that we've been studying to help us with dissemination. We've partnered with DPH on dissemination of information, talked with them extensively about what we were finding in our study as they were tailoring and changing messaging. And we've also worked with DSU's cooperative extension for tailored public health messaging there. So that's just brief what we've tried to do at each point of that research process to engage community. And I have to be clear that community can be community partners, it can be the trusted facility folks, and we're continuing to do the dig deeper part and maintain relationships in the community so that we can continue to have that direct connect to study participants.
Another question I have is one of the values of community engaged research is just offsetting this notion of that community folk have about being exploited. And another thing that community engaged research does is it validates the expertise that is in the community, that only people who are living the situations that give rise to the research can provide. And we've also talked about incentives. And when we do research, there are paybacks that we get. We get an article written, that can lead to promotion. It can lead to salary increases. What's your thinking about that kind of concrete benefit for community folk who are involved in community engaged research, being the co-PI, being a co-author, on an article, being actually, written, into, the budget, something that, validates how they feel about themselves and also helps to, keep the lights on and food on the table.
It's really important that, partners be paid for their time on the project. That really shows that their time is valuable and they have expertise that someone else is not able to provide. And honestly, in the work that I've done, they've often been the most valuable contributor to the grant or the project in that they have ideas about, recruitment strategies or about how to word certain questions that really make or break a study, honestly. So I think that's really important. I think, always including people as co-authors, if that's something that, we always do. Sometimes we have too many partners to be able to include every single person as a co-author on every paper, but we always include, parents as co-authors. And then I think the other thing that's really important is just to find out what's of value to that person. I think everybody on the team wants to improve care and outcomes, right? That's the ultimate goal, and we all have that goal, but that takes a while. So what else aside from payment, aside from, co-authorship, which may or may not matter to that person, is meaningful? And like I mentioned before, maybe it's, dissemination to the community. Maybe it is, we've, as part of the intervention that we created, we've developed materials. So videos of parents talking about their experiences and featuring their child, and just stories of hope and advice and wisdom for new parents going through this. And so, they've been able to share their story. And I think actually that's maybe one of them, for some parents, the most valuable and meaningful experience, and actually very therapeutic, was being able to be featured in those videos. So I think it's just different for every stakeholder in terms of what they're hoping to get out of this. But I think we need to make sure we know what that is and try to deliver that.
I was really enthused about that, Marlene. And, I got to thinking about like coming up with somewhat of a different model. And what came to mind when you asked that question was the SBIR or STTR grants that the NIH gives, which are technology transfer, innovation, invention. So they're a partnership between industry and who is the recipient organization, and that who receives the grant. And then the PI might be the investigator. Say, for example, if we partner with Agilent, then Agilent receives the grant, and an investigator at Nemours would be the PI. So it's just this beautiful model where both are involved and both are rewarded in different but meaningful ways, whereby the PI who's able to really conduct, the study, run the study, has that experience, is partnering with that institution or that organization, but they receive the dollars and are really engaged from the get-go. So I got to thinking about that, and I thought, oh, it'd be really great if we could do something like that or model it after that sort of funding opportunity.
Well, I have one question, and then I want to go to the chat to ask some questions that our participants want to ask. What is the most rewarding part of your work that you have found realized experience in as a community engaged researcher?
I think for me, as someone who's been in the lab for many years, is really seeing the endpoint and hearing the stories from breast cancer patients or communities that are affected by breast cancer, and being able to make that connection between what I'm doing and what the reality is. Because sometimes we get excited about, we find this pathway here or there, but really putting that in perspective of how is this really going to impact the community. And I think having those conversations with either breast cancer advocates who are very wonderful about providing their experience and their opinions, or even members of the community that breast cancer touches, it's really inspiring to me.
Anyone else want to respond to that question?
I would agree. I think just seeing the impact that our work can have, and knowing that what we're researching is actually what is meaningful to the community, I mean, it's huge. And so it's incredibly rewarding.
For me, I think
yeah, it's gone.
The inclusion of people with lived experience, getting them involved. The COVID study is a little bit more traditional research. It doesn't have the flexibility. I've got another study where it just kind of rolled into having older folks who were too old to be part of the study, doing the interviewing of the younger folks, and just their ability to communicate with each other in a language, that they understand, and being able to move away from some of the stilted questions. I think, Eric, you noted like having community folks tell you how to word questions and that kind of stuff. So, and just knowing that I'm helping contribute to more representative voices it is most rewarding for me.
I did want to add something. I think the involvement of our students, we have college students that have for over 50 years spend the summer with us and are involved in health equity research and other types of community-based research, seeing them get excited, seeing how they can make a difference, enhancing their awareness, and then our clinical fellows that come in. So it's training that next generation that I think is very exciting to me. And many of us have spoken about, we need, I saw there were certifications offered in certain aspects of community-based research. And I just think a lot of us would benefit from having some more formalized training. I know I would. I'm very interested in it, but I don't know really where to go to get that. So.
Well, let me go to the chat. There's some questions and comments. One is, I agree the time frame allotted by federal agencies to apply and submit grants is very restrictive. Therefore, it is more productive for both researcher and community partner to build relationships at least 6 months to a year prior to applications.
Great.
This allows sufficient time for alignment and project development process. Here's another one. When I worked with FH 1360 on research projects, we would always strategically try to find persons who were connected to the geographic areas / communities the research focused on, and found people who were reflective of the populations we were trying to reach. For example, if the research population focused on young Latinx women between the ages of 18 and 25. Then we hired young Latinx women as recruiters between the ages of 18 and 25. They were part of the research team, hired as research staff, and trained. This approach, where applicable, would always yield high response rates and participation in the research projects. Everybody's shaking their head. Okay.
Yes.
Here is a question. Is there a difference between an advisory board and a reality board? Any response? Is there a difference between a reality board and an advisory board?
I think we certainly need to make sure that our advisory boards are really representative of the communities that we really need in our studies. And sometimes I think that people who we often reach out to, who are, you know, the most obvious suspects, are not necessarily the people that we really need to reach. And so we really need to make an effort to really understand what populations we need in our studies and have representatives from those groups as part of our advisory board.
Okay. I think thank you. I think this question was addressed. Sorry if I missed it, but to the panel, in your research work, did you have a community partner as co-PI, and were they paid for?
I have not had a community partner as a co-PI. I have had community partners in different roles, like on an advisory board, as a study team member. Yes, they were all paid, but not at the level of a co-PI. And I think that that's really important. And that's a future goal, to have, you know, the decision-making power be equal. And in the other roles, it's not.
We did, ours was very similar, Erica. We do have community partners. They are paid. We have community folks helping us in a couple of different sites, and they are paid. As far as co-PI, I'm completely open to that. Again, I think some of the federal requirements around expectation of credentials needs to be revised. And I also know that some of the institutional requirements at our individual institutions, I know mine, also need to be revised to make that easier to do. I'm open to it. I've got co-PIs with lived experience on some studies, but don't always have the opportunity to do that because of restrictions of the funding agency or the institution.
Okay. one of our participants has put in the chat some links for free online research training for community and clinician investigators. Any closing remarks that you may have? I guess one question I have is why is a discussion like this about community engaged research important? That can be your response to the question can be your closing remark.
I think it goes back to training, and I will say, as a junior faculty member who grew up in ACCEL, I've been involved in ACCEL since just a few years into my faculty position, and that's where I learned about community engaged research. I was doing qualitative studies and qualitative interviews. I thought that was community engaged because I was asking people about their lived experience. And then I went to a presentation where they said, here's where that is on the spectrum. And here's how far you can go with it. And I was like, wow, okay, well, I need to go further then. And so I think that it's just about, exposing people who haven't been exposed before to community engagement, and having folks kind of recognize the challenges, but also the opportunities and strengths.
Okay, thank you, Erica. Next.
Until we have this model of research that we've talked about, some of the barriers today through the grant programs and the NIH, that it's very important for people to continue to reach out and have discussions such as this, because I think there are a lot of people who want to do this on both the community and on the scientific side, but overcoming a lot of these barriers and really having this kind of accepted format by all partners, especially our funders, that this is very important, will really help to drive this.
Thank you, Jennifer. Dorothy?
I'll just say quickly, since I've seen the red card for a while now,
Oh.
Karen, I see you. I'll just say quickly that we've highlighted a number of barriers to community engaged research. So if we've got to keep pushing the envelope to see the little changes that it's going to take to make the big changes. So,
and I will close that I have seen during this community research exchange and other ones how interested our community is in participating in research, and that excites me and it surprised me at times, especially even wanting to participate in clinical trials and not knowing how to do that or how to access them. So that's how I'll close and add on to what everybody else has said.
Well, thank you very much. I didn't see the red card, so I want to again thank you, ladies, for participating in this part of the program, and offering some very important, insights about community engaged research and reinforcing, why it's important. I want to invite everyone to come back at 1:30 for the workshops. The link to the workshops, which is different from the link for this morning, is in the chat. See you at 1:30. Thank you very much.
Thank you.
Thank you.